Hey everybody, it's Dave with No Chaser, and today's topic is about the tricky scenario of being in recovery, maybe early recovery, and having to have surgery, and the question of pain medication and the risks involved. Now, I'll tell you one thing, this is not some hypothetical scenario I'm covering. This is not something based on past events or, what I learned through others vicariously. No, 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 no. This is happening right now. In IRL, as the kids say. Just based on true events occurring now. So, no matter what, if you're in addiction or in recovery, life keeps on lifing, and life is always teaching. And I may not know what the lesson is, but life be teaching it. And so I tore my ACL, and I tore my partial tear of my LCL, which even now I still don't really know what that is. In fact, I realized I didn't even really know what an ACL was until recently. Like, I'm a sports fan, I hear about it all the time. Like, oh no, he tore his ACL. If someone would have asked me, why is that bad? I'd be like, I don't know. Knee stuff? Or, wait, is that your Achilles? Like, Achilles, ACL? Did the Greek god tear his ACL? That doesn't sound right. Look, I may have been a little under the influence during the whole Greek mythology classes in high school, so it's a little foggy. But anyways, I figured it out for the most part. Fun fact, your ACL doesn't really tear, it explodes. So, boom goes the dynamite for my knee, and now I got a little bit of a conundrum here. It's actually, I mentioned this just briefly in a previous video, and I've talked about it a little bit more on depth in the podcast I co-host, Shoeless in South Dakota. But, finally, the wheels of progress churn slowly. It felt like they haven't even started churning because, I've just been waiting for surgery to happen. And when I drop this, it will be in a couple of days. And so, one sidebar, if you know someone older, and I tore it playing basketball, but if you know someone older who got an injury through being active in something, don't tell them, oh, you're getting too old, or you're too old for that. First of all, I know. I'm not colorblind. I can see the grays here, here, here. Oh my God, the first chest hair gray, I can feel the cruel pressure of time. But, so yeah, don't do that. Another thing though is that this is not my first rodeo. If you're my age and you lived the life of an alcoholic and addict, a lot of things are not your first rodeo. Actually, a rodeo would be my first rodeo. I've never done that. But anyways, so when I was probably about 32 at the time, I had to get my wisdom teeth pulled. Now, I have bizarrely young sort of teeth growth throughout my life. I don't know. It's very weird. So, most people, if you're hearing wisdom teeth, are like, what, you're 32 when that happened? Usually people cross that bridge much younger. But not only that, they were still kind of up there, so they had to, it was more like oral surgery where they had to cut, some of them out. I won't get too graphic with it. Basically, I wish I aged like my teeth. So they were super young and had to have this oral surgery and whatnot. And at the time, I was 7 months clean and sober. And, the thing is that I, at that point, and still haven't, in a very, very long time, done any opiates. However, the first thing I actually really got addicted to was opiates when I was 15. And that was kind of that whole addiction was a smaller period of my life. The funny thing is, when I thought it was over, I was just like, whoa, what a dark period of my life. The good thing that's done. It's like, no, we're just getting started with alcohol, the main event. So it's been a really long time, but still addicted to opiates. And so that was weighing heavily on my mind. Like I said, I was 7 months sober. And so I felt pretty good where I was at, but you know what? I didn't want to risk it. I really didn't. I just, at that moment, I kind of made the decision, no narcotic pain medication, and we're just going with that. And it wasn't super fun, but it wasn't as bad as I thought it was going to be. And I kind of just gutted through it, and, it felt kind of like a victory. I was like, good, no, we were able to do this. We put our mind to something, and we did it, and that's totally fine. I swear to God, the doctor kept, before I left, so you sure you don't want fucking cool the hydrocodones? Just come on, dude, do it. He asked me 4 times. I swear, when I drove away, I thought he was going to pop up in my backseat in the rear view window. He's like, you sure you don't want pills? So I was just like, whatever. But, when I was, when I went to talk to the specialist about my knee ouchie and what are we going to do about this, I told him my whole history. That is what I would super suggest to do. I mean, almost not even suggestion. If you want to stay like sober and you just want to actually live in that like correct way, so to speak, you got to be transparent and you got to tell on yourself, however you want to call it. So I had, I told him, here's my deal. Major drug of choice, alcohol, however, have been addicted and still, you could say still addicted to opiates. And yeah, so I don't know about the whole pain medication thing. And he said, and I told him about the previous experience with the kind of, the wisdom teeth stuff. And, he was almost flippantly like, well, this isn't like pulling teeth, and I was like, first of all, it's oral surgery, but go on. And he was like, well, this isn't like pulling teeth. This is going to be a little bit more intensive. And I was just kind of like, ooh. Because that's the kind of two factors in this new fun little predicament is that, one, it's going to be, as the doctor meanly stated, it's not just pulling teeth. It's going to be a much more extensive it's a knee reconstruction, right? God, I feel old. But then not only that, however, I am not up to 7 months, yet. And like at this point, I'm a little over like 2 months. And so, but he was just like, well, I don't know. And so this time there was a little bit more mulling it over as far as what I was, going to do. Like maybe just have the, just pain medication day of surgery, or, you could get some and then have someone else hold on to it just in case you need it. And I just was like, I don't know. We'll think about it when we get to that, because there was a long period where the surgery was just like, postponed for a while. Been in a knee brace way too long. So, however, to kind of like extrapolate this in some sort of general topic or discussion, the risks of relapse are obviously there's going to be some if you take any narcotic pain medication. There's the idea that they open neural pathways that may have been dormant, and a lot of it also depends on how long you've been clean and sober. And the key word is also clean, like if you have any experience with drugs or not. However, even if you don't, though, that doesn't mean nothing. You're like, well, I'm just alcohol. That doesn't mean anything. Just any mood altering thing. It's kind of like, what a lot of alcoholics believe is like, I can't do nothing. No, obviously no hardcore drugs, but no weed, no nothing, because it will lead me back to alcohol. It's just in the same way a lot of addicts are like, alcohol will lead me back to the drugs. And so the funny thing is my sponsor, a little while ago, he had double knee reconstruction. It was like crazy extensive, like both knees. He might as well just been on like stumps for a while. It was nuts, and he was down, and it was horrifically painful. And so he was taking the narcotic pain medication. He had never done anything besides alcohol, but he was very wary of it. And the crazy thing is he had told me just even after just a little bit, he just quit. He was like, I'm done. I'm just flushing them the rest down the toilet, because he said he could feel himself get addicted just on a physiological level. And I mean, how many times do you hear like the tragic story of the person who wasn't even drinking heavily or using drugs, but something happened, some back injury you hear a lot of times, and they just get like a never-ending prescription of opiates that they take prudently to begin with, like correctly and all that stuff, and then it leads to this, horrific addiction. I mean, really, really sad. And so that you super have to consider, if you've already lived that life in a sort of way, how do you think you're going to handle, like, and this is a real sort of, like many things in recovery, there's going to be a lot of like real, like gut check times where you got to be just super honest with yourself. Like really, try to wipe away all of any delusional thing you want to believe, or all the justifications you may make, or anything like that. Watch how you even ask for advice. Are you asking people that will agree with you in the thing you want to do, that you maybe in the back of your mind know isn't the greatest? And so, when it came to this, I brought it up, I talked to some people about it, but I didn't really even ask for so much advice, as far as I was just kind of like listening to myself in a way. And I was like, dude, David, how do we really feel about this? And so, I went to the anesthesiologist, and, again, being rigorously transparent, I told them the whole deal, and I told them, this is how long I've been clean and sober. This is what I've been addicted to. Didn't go into everything. I don't have to tell him that, I've slept in a dumpster before and drank vodka at 6 in the morning. He's like, dude, that's fine. We don't need all the nitty gritty. But, I told him everything. And the one thing that came to my mind, too, is that, if I don't take pain medication, narcotic pain medication, obviously going to be popping some ibuprofen and whatnot, but if I don't take any, one way that I could look at this would be like, how many times have you gutted and just, grinded through withdrawals before? Like, I've done that. I've done that in a hospital. I've done that in jail, which is super not recommend. And on the couch a bunch of times. Horrific. Sometimes the DTs, there was a time where I was coming off, like, way long ago, again, back to my younger opiate days, I was coming off alcohol and methadone at the same time. I was like, man, you were able to gut it through that. Maybe just, like, consider it like that in a way. Maybe try to frame it that way. That, dude, you've done this before, and without the enticement of getting some sort of chemical intoxication, do that. Because I talked more with the anesthesiologist, and it was like, all right, here's the deal: no narcotic or opiate pain medication, not even during surgery. They're going to use some other stuff, numbing agents and stuff like that. And one of the main reasons is because I'm actually, just like as a side thing, I'm taking naltrexone. So one of the questions was, if I was going to do it, when would I stop taking it? And one of the big things was like, you know what? I don't know if it would be a good idea if you stop taking that. I don't know truly how effective naltrexone is, as far as it's supposed to be helpful for cravings. It's also kind of a deterrent, because if it's an opiate blocker, if that was your drug of choice, and it blocks the pleasurable effects of alcohol. I've done a whole video about it, but anyways. So it was one of the questions of like, all right, so if we're going to do this, you have to get off that. And it was just like, I don't think it's a good idea for you to get off that. And so if you don't get off that, it's almost pointless to prescribe any opiates, because they're going to be blocked. And so kind of the consensus was no narcotic pain medication, which, super not looking forward to. But in a sense, I'm like, okay, again, that reframing device in my own head of just like, this will be a thing that you'll gut through. Because again, one thing I also realize is that this is going to suck. I'm going to try to be more positive. This is going to be not fun for weeks, but it won't be agonizing pain for weeks. Like, the plan was not to take any pain medication like that for weeks anyways. So really what we're looking at is a couple of days of a lot of ibuprofen and Tylenol and just trying to gut through it, which I think is doable. Now, here's the other thing. If you are in a scenario like this, I'm not saying, you got to do what I do. In fact, if you'll notice, a lot of this channel is don't do what I've done before. But if you're in this scenario, I will say one thing is that, and I've experienced this as well. Pain, especially severe pain, can put you in a bad headspace. I was talking with my counselor, and one of the worries that she actually had wasn't just about the relapse from being triggered by the use of any opiates or anything like that. It was actually more so dealing with the pain afterwards and being immobilized and stuff like that. So, one of the things that I'm actually, mentally trying to prepare myself for is that it's one thing to get through the hump of like the excruciating sort of acute phase of pain, but also what I'm going to do after that, how I'm just going to deal with pain. I know a lot of people that the reason they started drinking and using was just because of physical pain. And I'll tell you what, physical pain can drive you crazy. In a way, it's on par with like not getting enough sleep, like not getting a lot of sleep and slowly going kind of nuts from that, or just becoming incredibly irritable. It's like pain is almost in like the same way, an amped up form of being hangry all day, and it doesn't matter what you eat. So, I mean, that's really something to consider. But like at the end of the day, if you're in this scenario, again, a real sort of gut check of honesty. Like, one thing is just, are you looking forward to it? Is there a part of you that's looking forward to it? What sort of measures, what sort of support? Because, in both these iterations of the teeth pulling from a couple of years ago and right now, I have a good support system. I have a lot of people in my life. I have people I can lean on and stuff like that. If stuff does get kind of, from the physical pain, just mentally and just feeling alone and stuff like, I have a lot of stuff like that. So it would be a good idea to, if you're going through this in whatever way you are, to have somebody you are in contact with. And if you do go the route of pain medication, you're taking it prescribed, but you're starting to worry about it, or you just, maybe if you need someone to hold on to it for you, if you have to, just drop the pride, dude. It's all right. It's fine. You got to do whatever just to make sure, because you don't want this random life thing to throw you off of your recovery if you've been doing well, if you've been going at it. You work so hard for it. It's just like you really don't. Like, one thing that I've learned more and more in my life and kind of my journeys and my failures and all that type of stuff is that really I can't be too hyper vigilant. Like, at this point, that's the way I feel. I cannot be too. It's one thing to just worry pointlessly. Don't want to do that, but it's not being too cautious in a sense. I don't want to start over again. I don't want to relapse. I don't know what happened if I did relapse. I don't want to induce cravings in me. So I'm going to take the measures that I think I need to take. But if you're in the same scenario, again, have some form of support. Have some idea of what you're going to do. Have a plan. And then the gut check of honesty. What is really going on in there? How do we really feel about this? And if you can do that, I think you'll be all right. I think I'll be all right, but it may suck. But, a lot of things suck. It will pass, hopefully.